Well, thanks everybody for joining. I know it's been a long day for many of us, and I really appreciate our partners at Redox putting this together on such short notice. The timing is perfect, as last week we came out with an expanded offer to all persons with diabetes and their clinicians for a free version of our offering called Remote Care Solution. That helps address what is going on with the COVID-19. So just want to take you guys through a quick overview of who Glooko is, how we play in the diabetes space, and what this free offer is. And again, thank you to the Redox team for putting this together. So Glooko is the largest diabetes data management and analytics platform in the world. We have over 9,000 clinical locations across 25 and rapidly growing countries. About 2.8 million PWDs is the lingo that they use in the diabetes community, which stands for persons with diabetes. They use Glooko to manage their diabetes with their clinician. And oftentimes they do it in a remote way. I'll just give you a high-level description versus taking you through slides of how Glooko works. It's basically an ecosystem of primarily software, but in some cases hardware, that pulls together the data, the glucose, the sugar, the readings from all types of diabetes devices. And if you're familiar with the space, the problem is there are literally hundreds of different devices that diabetics around the world use. Some of them are very smart. They are Wi-Fi and Bluetooth enabled and can be easily connected. Some of them, however, are very, quote, dumb. They are ones that you can only plug in a cord to sync. So what Glooko does is across all these devices for all of our clinics, imagine an endocrinology clinic seeing hundreds of diabetic patients with a myriad of devices. We provide one platform that helps the clinicians bring all of that data for all of their patients into one location. It's one interface, one analytic platform, regardless of the device, regardless of what insulin's used, et cetera, et cetera. That way the clinicians have one portal and their staff have one portal to log into to help their patients manage diabetes. And for some diabetics, type 1s, for instance, they are in their office, the office of their clinician, as much as every other week, if not more frequently, with complications. So this chronic disease is very challenging because it's a very high-touch model. And so what we're trying to do with Glooko is not only serve that and address that problem of all the different options available in the marketplace, but we're also trying to help lower the need to go into in-clinic visits. We also, through our partners, Redox, integrate into the EHR system two ways where we pull down information from the EHR and we also publish information to the EHR. So our mission is pretty simple. It's to improve the lives of people with diabetes and those who care for them by simplifying collaboration and delivering actionable insights. That simplifying collaboration is the key. What we're trying to do is connect the diabetic patient and their clinician. We're also trying to connect the remainder of the diabetes ecosystem. So for instance, a employer who is providing a program for all of their diabetics is partnering with the clinician, and with Glooko in the middle, we can simplify that collaboration and make their offering much easier to deploy, much easier to use for everyone involved. And frankly, as many of you know, in the world of healthcare, making it simple typically makes it much more effective. So as I mentioned, Glooko is really an ecosystem. With this clinic footprint, we not only serve the PWDs and their clinicians, the providers in the health systems, but we also provide insights into the payer and the care management teams through population health and risk analytics. We also work with the device manufacturers, and the pharmaceutical companies to do clinical research, for instance. We provide front ends for many of the diabetic devices where they don't have a data management solution. They use Glooko. And so what we're trying to do with this platform and our software and solutions is really connect the entire ecosystem together to make it simpler to administer healthcare. And as you see in the bottom left, EHR integration is an important component because while the diabetic devices, the meters, the strips, et cetera, capture quite a bit of data, there's even more found in the EHR. And so by creating the two-way integration with Redox, we're able to connect the two dots without us having to do the direct integrations. So while we already had this solution in place, we felt it was necessary to really amplify our offering to the market in light of COVID-19, because diabetics, while inherently aren't more prone to catch the disease, because of the complications and comorbidities that diabetes patients suffer with, they're much more likely to have complications from catching COVID-19. So the goal is to help minimize the risk of exposure. So what we offered, what we created, was a customized version that was completely thin client, no hardware needed whatsoever. So, and no visits to the clinic necessary. So the office can simply just fill out the form on our website and sign up. That takes, just a couple hours to get signed up and ready. Then they can start adding their patients. The patients can download the app from the App Store, and it's very easy to get going. And then the patients simply sync with their device with, say, their iPhone or their Samsung or what have you. And then that information is sent to their clinician via Glooko's secure, privacy-protected remote care solution. I certainly appreciate that a lot of the regulations are being waived in this COVID time, but I think for systems that have the security, the privacy piece worked out, that in the long term, they will be the best solutions, because that's a key part of any HIPAA-regulated world. And even beyond HIPAA, we deal, as I said, in 25 countries. So we're dealing with other privacy concerns around the world, some of which have not been waived. So what this solution does is, and I'll just walk you through, the clinician requests a remote care ID, and then they can set up, as you can see in the screenshot, each individual patient, and it sends out an invite. The patient clicks through, downloads the app, and immediately can start syncing and sharing their, in this case, average blood glucose, average CGM active days, et cetera, et cetera. And then the clinician has one window for all of their patients to drill into, to create reports and analytics, and they can provide remote care, remote treatment during this time of COVID-19. Here's an example of what the app looks like for the user. It's free for all users. They can create a Glooko account and just connect to their clinician's ID and then start syncing. They can log their food, exercise, and other elements, although we also partner with other folks who do that, set reminders, et cetera, et cetera. So it's a completely self-enabled system for the patient, and then all that information is sent to their endocrinologist or their primary care physician, and they can then in real time work through what's going on, what challenges they're having. And the important part is they do not have to go into the clinic and expose themselves to potential COVID-19. In this solution, we've also really streamlined the onboarding by eliminating the need for hardware, which is a key piece, especially in supply chain constrained markets. around the world, and that we see that spiking in other areas, probably more so than we do the U.S., but it's definitely a consideration. And it provides access to all the interactive visualizations and analytics that we have immediately. There's also options if they want to upgrade to even more full-featured. We offer that, and they can, of course, continue their subscriptions after the pandemic. So I know it was a quick overview, but I really do appreciate the time, and I'd be happy to field any questions through the feedback mechanisms. And thank you very much, Redox, for putting this together.